I think as a warm up here, I'd like to hear what you think about this. Just a couple of kind of warm up questions because it's just kind of give us some context in terms of things to be thinking about. So this is a fill in the blank question.
Okay.
So here we go. It's two parts, so a little challenging, but I think you got this. So we need more blank in healthcare digital marketing. How would you answer that?
It's a family-friendly show, right? Um, do we need more? I'm going to say not just now, but from my prior experiences on the healthcare provider side, I'm going to say coordination between comms and the web team. They
Ooh.
really should have a symbiotic relationship there because one shouldn't be able to survive without the other. I mean, the web team needs the information, comms needs the platform. And I can't tell you how many times in my career, I've been, or I felt like I've been the last to find out something because I found it out on a website that wasn't my own. And then I had to go and tell my team, oh, by the way, we need you to post this up. Oh, yeah, this newspaper had it up a couple hours ago. So I think, especially in a situation like this where information's critical, coordination between comms and the web team to make sure that they are lockstep in their messaging is key.
Awesome. All right. So what about the flip side of that? We need less of blank in healthcare digital marketing.
Less a blank. Throwing things over the fence.
Oh,
It almost feels like now more than ever, the web team, or at least whoever's leading the web team, needs a seat at the table, not just the comms table, but from a larger digital strategy perspective. And, in many organizations, I still hear a lot about just, things are brewing and they're far, far away. Then all of a sudden, boom, they hit the web team. The web team has to
yeah,
make lemonade. And 9 times out of 10, they do. But things would probably be better. The products would probably be better. Everyone would be happier if the web team was involved from the start of every project that's going to end up on the web in some way, shape, or form.
for sure. Which happens to be like just about everything, it seems like. So yeah, I can see how
Pretty
important that
much.
is. Yeah.
Pretty much. And that's the thing too. When I look at times like this, I mean, this is when a good web team can thrive and shine. And you go from the work you have to do all the time, maintaining physician records or changing this, that, or the other throughout the website and trying to keep your arms around 15,000 or 20,000 pages. And now, I mean, these web teams can be hyper focused on what is arguably the single most important page on their website right now. And that's the coronavirus COVID-19 update page where you're telling people, can you visit the hospital? If you visit, what are the rules? I've heard about a number of hospitals canceling elective surgeries, and other important things that are core to the business. And also, the other interesting thing too, by the way, is times like this, they really do shine a spotlight, not only on the good things that the web team can do, but all of a sudden you start seeing all those cracks or all those things you swept under the carpet for so long. I was talking to a friend the other day who was contacted by someone in his organization that wanted to send out an email to all of their patients that had signed up for the portal, which was actually not possible because of the way things had been architected. I mean, they had never tried to do it before, and now that they needed to do it, they couldn't.
Mm.
Something that seems simple, there's a lot of hurdles, and unfortunately, not enough time to hop over those hurdles at this point.
I agree. You know what? I think once we're getting past the kind of the initial shock of what's going on, I am genuinely. It feels weird to say it, but I'm genuinely encouraged. I'm like, look, you know what? What we're telling the world is that it is possible to have this kind of new work life, and it's possible to adjust to things, and life is going to go on. Like business is going to go on. Uh, Everything's going to go on, even though, yeah, some things have shut down, some things are just being postponed, but life's going to go on, and we're going to be okay. And yeah, lots of adjustments, lots of questions, lots of things we've never had to deal with, and yet we're going to be okay.
And the web is really at the center of it. I mean, if you think about it, if you go back just a couple of years to SARS and West Nile and everything else, I mean, a decade ago, you wouldn't have expected that every time you went to a news provider's website, there was some breaking story, there was some new update. But this here, I mean, this is almost pandemic in real time. I mean, every time I pull up the Washington Post or New York Times, and it could almost be every 5 minutes, there's some new story. And I think that also puts healthcare providers in a unique position as well, because people are inundated with so much information. And now that's a big question. We were talking about before we hit record, like where does a hospital website fit into this connected world of news in 2020?
Yeah, I don't know if you're finding the same thing. It's related to that though, because I think with social distancing, we're going to tend to think, oh, we're going to interact with people less. I guess I feel like I'm going back to those colleagues who I've had a relationship with because I've met them in person, like at a conference, at an
Hmm.
HCIC or some other conference. But particularly those who I've realized, are kind of part of my tribe. I've met them in person. We've hung out, yeah, at an HCIC session or afterwards or whatever. And those are the people I've realized are the ones who I've kept in touch with the most. And so I don't know if you found the same thing, but I just found that was an interesting, kind of almost surprising aspect of the whole situation that's going on now.
Yeah, and actually, from the moment I started working remotely and I gained that extra time, I found myself reaching out to more people, and yeah, the HCIC tribe and just healthcare Martech people in general. I kind of feel that it's a such a close knit group. Maybe it's like this in other industries, but I don't know. I really feel like it's a very very tight group of people that stick together, and it's almost reassuring seeing everyone on LinkedIn and Twitter and chatting back and forth and just emailing about things, and not always healthcare related. I mean, a lot of other stuff, it's something where, having the extra time, I feel like, I wouldn't have necessarily had the time to reach out to all these folks if I was spending 10 hours, 12 hours, 15 hours a week in the car.
Good chatting with you, Andy. I mean, good stuff. Good to just, at the very least know that others are in the same boat and are asking the same questions, and you've been able to figure out some little victories and some wins along the way.
Oh, exactly, exactly. And I swear this is what web teams are built for. Times like this, and the good web teams are stepping up, and we'll get through all this. This is just another challenge, and at the end of the day, I mean, I think the web teams that do a good job and pull together for this are going to be well positioned moving forward, and will have even better footing within their organizations.